So now we're going to go to page 55 of your skills book, and this is what you'll see. Perform passive range of motion to the elbow and wrist. Now, we've already seen 2 range of motion skills. We learned range of motion of the shoulder. We also learned range of motion of the hip, knee, and ankle. So this is our 3rd range of motion. This is passive range of motion to the elbow and wrist. Now remember, with all range of motions, you need to know what exercises we're doing, what body parts we're exercising, and how many repetitions. So this skill tells us to perform passive range of motion to the resident's right elbow and right wrist. We're going to perform flexion extension, which is up, down. That's all we're doing is up, down of the elbow, up, down of the wrist. We're going to provide 3 repetitions of each exercise, and the resident is not able to help with the exercises. So if you remember, flexion extension was an up-down motion. So let's go down to the bottom of the screen here. You can see that this is a short skill. The test estimates that somebody with your level of experience should take about 4 minutes to do this skill. It will be done on another testing student who will be laying in bed, and documentation is not required. For this skill, you have to do flexion extension of the elbow and the wrist 3 times each. But this isn't like the hip and knee. Remember, the hip and knee was done one exercise, did both joints. This one's a little bit different. The elbow will be done separately from the wrist. Now, the elbow can only go in one direction, guys. That's it. The elbow can only go in one direction. If you get an elbow to do anything but this, you have broken it. Okay? Elbow only goes up and down. But the wrist can go in all different directions. Your wrist has full range of motion. It can go up and down. It can go side to side. It can go around. But this care plan only tells us to do flexion extension. So up, down is all we're going to do. So this is going to look like the patient is making a muscle. We're going to keep the elbow on the bed so it's supported. So we're going to make a muscle 3 times, and then we're going to rev a motorcycle 3 times, up and back. Okay, we'll explain what we're doing every step of the way, because patient education is super important. In order for them to know what we're doing, we have to tell them what we're doing. All right, great question, Sherry. She says, if for whatever reason the patient isn't lying flat, should we lower them? For the test won't be an issue. The bed will be in the flat position. You won't have to worry about that. In a clinical setting, if you're just doing range of motion of the elbow and wrist, you don't need to lower the head of the bed, because both of those can be accomplished with the patient in a sitting or laying position, doesn't matter. But if you're doing range of motion of the hip, knee, and ankle, they do need to be in a flat position, because you can't really get a good flexion or extension of the hip if they're in a sitting position already. So the head of the bed would need to be down for that, but for the test, the bed will always be down for all range of motions. You won't have to adjust it. Same thing with shoulder. To get a good flexion extension and abduction adduction, it's going to be easier if the bed is flat, if the patient is laying down completely, because otherwise sometimes it's hard, especially if they're a little bit tall, to bring that arm all the way up, and you don't have good control or support of that extremity as you're extending it over their head and bringing it back to the bed. So for elbow and wrist, doesn't really matter. For the other range of motions, yes, the bed should be flat. So I'm going to play this video for you. It's going to show you what to do for this skill. It's a super easy skill. Probably the easiest one that we learn, to be honest with you. If I were to pick my skills, this is one I would pick, because it's super easy and super quick.